Today, at this stage, I introduce our speaker, Stephen Goldsmith. Steve is extremely interesting, has a tremendously varied perspective, and I started reading, it's always dangerous to start reading a person's writings before they get here, but this Power of Social Innovation, very interesting perspectives on the intersection between thinking and implementation. Actually, it's a nice fit for the Bedrosian Center and things that we do. But he has a very on-the-ground, real-world applied background. While he's a professor at the Kennedy School right now and the director of the Innovations in Government program, most of his background has been in the public sector. He was a prosecutor in Indianapolis, a longtime mayor in that city. He was a chair at the federal level for the Center for National and Community Service. And after doing that, eventually got to Harvard, but has not actually stayed at Harvard. He went to Washington to be the director of their Anacostia River redevelopment effort. He took a leave for 2 years to be a deputy mayor in the city of New York. And so can't seem to stay away from those public sector positions, but continues to inform thinking among leaders in social innovation and in public policy more broadly, and he will undoubtedly have food for thought for us here today. So please join me in welcoming Steve Goldsmith.
It's nice to be here. I'm somewhat intimidated by your list of speakers, all of whom I know, many of whom with whom I've worked. You've attracted quite the, if you want to name the top folks involved in the social innovation movement, many of them are winding their way through your conference table. So it's interesting. You say Sonal's on her way here next, which is good. I hope maybe there'll be you'll consume this book and you'll advertise it widely and enthusiastically, and people will consume it. So I don't I assume this works like anything else. Okay, so let's just, let me spend a few minutes. I think probably, let me go back, it's been some time, but let me go back to Indianapolis for a second and then come forward. And unlike most of you who are like true academics, I'm a professor of practice, which means that, you know, I'm not as academically pedigreed as many in the audience, and therefore I'm less concerned with kind of the details of accuracy. So when I started to write my book about social innovation, I decided I could not and would not define it. So I'll talk about kind of this definition I put up mostly for purposes of you thinking that I'm rigorous enough about this exercise that I've actually defined it, but the cases I haven't, I gave up and wrote the book anyway about a subject I never defined, but we'll kind of go back to that. Let me go to Indianapolis for a second around the following concept. So I got elected mayor in Indianapolis in the early 90s, a period of time that was quite difficult for cities. Several of us got elected at about the same time, all of whom were friends, Ed Rendell in Philadelphia and Rich Daley in Chicago and Kurt Schmoke in Baltimore, and we all became mayors at a particular point in time, and I decided that what I wanted to do was, the reason I wanted to be mayor is I wanted to take the most neglected neighborhoods in Indianapolis and I wanted to make the lives of folks in those communities better. So I wanted to do everything I could, and I don't want to go through that whole process, but as part of that, began this, what many of you know, exercise to identify the assets in those communities for purposes of leveraging those assets. And the assets were small community groups and faith-based organizations, almost exclusively in Indianapolis at the time, the church. And these were little pastors and small community churches. But the point of the story is that as I got farther into this, and I saw some of this as I was leaving as district attorney, you know, I began with this and ended with this faith that the nonprofits would be the innovators. But more and more I saw that what government was doing was making it difficult for them to innovate, and often what they were doing was making it difficult for government to innovate. And so I want to step back for a second. So if you go back then 15 years to the point where I wrote the book, or a dozen years thereafter, I started to write about social innovation because social innovation, to me, I've been the chairman of the Corporation Access Committee Service. I was, in charge of the AmeriCorps and VISTA programs. We funded a lot of the innovators that you read and touch, the Teach for Americas and the like around the world and around the country. So we began to kind of think that those were the sources of innovation. But the more I stared at it, the more I realized that makes an assumption, right? That makes an assumption that social innovation comes from the social sector, and it doesn't come from the government sector. And if I went back and thought about my experience in Indianapolis and took it forward to my experience at the Corporation National Community Service, I realized that the ecosystem of social innovation was the problem, and innovation could come from the nonprofit sector, it could come from the government sector, and to assume that it comes inherently from one sector and the other is a problem. And therefore, I wrote that book about social innovation, looking at civic entrepreneurs and not social entrepreneurs, because the entrepreneurship could come and be driven by the government. So now let me go back. I'm going back and forth in time, but for purposes. So when I was leaving as district attorney, a very good friend of mine was a juvenile court judge in Indianapolis, and he was a very strong and very committed gentleman. And he exercised a lot of authority, right, because he decided where children who were wards of the court, children in need of services, would be placed. And what was happening was the nonprofits were making proposals to him for placement. And so their proposals for placement were for a group of kids that were amenable in their opinion for placement, right? So he got a lot of people who wanted to participate with this set of kids. But the problem wasn't this set of kids, it was the tougher kids. And so he was not getting outcome-based proposals for innovation from the nonprofit sector for placement of those kids, right? So he, the judge, defined what he wanted to do, right? He disrupted the current process and created social innovation by saying, this is what I'm going to buy. I'm going to buy outcomes for this particular type of hard-pressed kids. And you guys can bid on it, or you can go out of business, right? And so he was a little more political than that, obviously, but the resulting uproar was enormous. It was very difficult, and I teach a case at Harvard, a Kennedy School case called Oklahoma Milestones. It's also an old case, but in Oklahoma Milestones did the same thing, right? They paid nonprofits to provide coaches for adults with disabilities, right? And the nonprofits got paid per day, per coach, per adult with disabilities, right? And so you can figure out what you get the activities of coaching. And many of these coaches were MSWs, right? And they became connected to the people they were trying to help, and they came to the conclusion that those folks they were trying to help could not succeed without them, right? And so we bought a lot of coaching days. And so somebody inside the system in Oklahoma's State Department said, look, this is not right. We ought to pay for the outcome. The outcome is they get a job, they have an independent life with support systems, and they keep that, and we'll pay for that. And so they changed, just like Jim Payne, the judge in Indianapolis, did, they changed the mechanism for procurement. The only point of this is to kind of begin this kind of path through the definitions that we're talking about today, which is, these social innovations, they can come from anywhere, and government, through the use of its authority, from where it places kids, from how it pays for outcomes, can either be the source of innovation, or it can be the source that squeezes out innovation. And as deputy mayor of New York City, it was, that social service area was run by one of the most talented public officials in the country, a deputy mayor named Linda Gibbs, and they had a huge footprint in the nonprofit world. And in the end of this talk, I want to come back to Linda and figure out how she used that footprint to either change innovation or to prescriptively kind of drive results in a way that was not innovative. So, to me, social innovation basically is, for lack of a better definition, it's a spark that brings these sectors together to help people in their daily lives, right? So I'm trying to create an environment for innovation. And social innovators are those who think about these issues and drive innovation. You can define this more precisely, but I think it's actually a hopeless exercise. I had this conversation at the Kennedy School for a number of years about whether social innovation was a real discipline or not, right? I mean, whether it's inherent in other disciplines. And basically, I'm a pragmatist who likes to see cities get better, and I decided in the end I really didn't care. I mean, it's the result that made the difference. This is a great book by an author, Stephen Goldsmith. I think it's relevant to the presentation, but my office puts it in there every time anyway. So I'm thinking about innovation in the following way, right? And I had a brief conversation with some of you before right now. My work basically is in the following theory, that government is set up and works vertically and people live horizontally. And therefore, big innovative changes, which are horizontal, right, are not susceptible to the delivery systems that we have in government today, right? So I started in the Midwest, prosecutors collect, I think they do in California, collect child support. So I started my job as representing every AFDC mom in Indianapolis was my client, right? And their lives were hugely complicated. And they wanted to succeed, and we had a government program for everything. That's probably not the place to say it, but I was the chief domestic policy advisor to President Bush in the 2000 campaign. I would stay up at night trying to think of a problem for which President Clinton did not already have a program, right? There was no problem in America for which there wasn't a program, right? And my child support moms, you know, why were they not working? Dad wasn't paying child support. They were abused. They couldn't get child care. They were discriminated against. They fill in the blank, right? There was 20, 30 different reasons. So, but it doesn't work very well, and the sources of social innovation are those where people think and operate in systems that are more horizontal. And government increasingly is being transferred from a direct service provider to a generator of public value. And I want to come back to the definition of public value. We're not going to be able, we just don't have enough money to get to the social solutions we need doing things the way we do it now. So these are some of the ways I'm thinking about it. I'm not going to go through this whole slide. When I start thinking about social innovation, when we did the Social Innovation Fund with President Obama, we began with the following kind of question, which you all know and think about day to day, but if we talk about innovation in the social sense, we have to start with this. Kind of what is the public value we're trying to create? So let's go back to Linda Gibbs. So Linda Gibbs was in charge of homelessness in New York City before she became deputy mayor, and she walked into the office one day and said, you know, what is it we're trying to do? And they said, we're trying to provide high quality shelter care for folks who are homeless. And she said, no, that's not what we're doing. What we're trying to do is prevent homelessness. Shelter care is what we do when we fail, right? So I use that because this definition, social innovation, is often driven by a more refined sense of the outcome we're trying to purchase. When Tony Williams became mayor in Washington, D.C., he's a good friend, and all of us who have been mayors have had underperforming public hospitals. Just the nature of the public hospital is that it's very difficult to make it work well because of the resources it has and the problems it faces. So he got his staff together and said, what is it we're trying to do with our public hospital? And they said, we're trying to be the best public hospital in America. And he said, no, no, no. We're trying to provide the best public health in America. And a public hospital, maybe we need an emergency room, maybe we need a burn center, maybe we don't, maybe we purchase it elsewhere. What we need to do is have a network of community clinics that intervene in the lives of folks who have inadequate health care earlier. Now, you can argue about kind of whether he's defined it right or wrong, but I don't think we can get to the conversation about social innovation without the conversation first about public value. And that is something that you as a school and many other academic institutions pay a fair amount to. This is, these are the pictures that explain what I just said. Because I don't want to, here, so let's talk about this for a while. I think that the opportunities here are centered around how does one use social innovation to create an innovative jurisdiction where the social outcomes are healthier and more effective for the dollars that are spent. And whether it's LA or New York or Indianapolis, you know, we operate inside these systems. And there are people in the systems who can cause it to operate differently. So if we think about catalyzing change, we're looking for a source of that change. Let's see if we can kind of go around the circle here for a second. So, you know, one is obviously to use data better, track problems, and use analytics in a much more effective way. This judge I mentioned in Indianapolis, Jim Payne, became the state director of Children's Services began to use big data and data analytics to look deeply at, all of the data available around a family in order to help make the decision about where a child should be placed, to measure the outcomes about where a child should be placed, to figure out which children should stay in the homes, figure out which services should be in the homes, to figure out how long those services should be in place, to figure out what, what the right and wrong approaches were by workers. So the data systems are so much improved that the results are better. The next column down on the right, I guess that's at, I don't know what that would be, 2 o'clock. Create new funding mechanisms to address risk. And you've already heard from, you've heard from Paul Carter already, right? So Paul worked with me on the Social Innovation Fund. I assume we talked about that, right? I think it was just a little bit of money, but it was a really important idea from the president, which is, look, instead of issuing the standard government RFP that says, here are the 25 things you need to do over this 500-page RFP to get our money, why don't we just say, what's your big idea, right? And how should we measure your results? And then we'll give you some money. Right now, this is not the way government normally operates. And again, the Social Innovation Fund was a relatively small amount of money, but even though it was leveraged a little bit, but it was a different way for government to handle its contracting. And so the way government issues those dollars are important. Many of you have read about the social impact bonds, weird name actually, taken from the UK, but the social impact bond that Mayor Bloomberg and Linda did with Goldman Sachs in New York City, which has great hope, which is basically, here's a pot of money. We're going to measure recidivism for juveniles from Rikers Island and for those involved in Rikers Island, and then we're going to pay you for improvement. And if you do really well, you'll make a lot of money. If you do really badly, you won't make very much money or you'll lose it. And if you hit the benchmarks, you'll be about the same place we are, right? So instead of saying you need to do family therapy, you need to do mental health counseling, you need to do drug counseling, you need to do this, you need to do that, and basically say, look, here's the money, figure it out in an ethical way, and we'll pay you for results. And so I think the social impact bond opportunity is an important one. The New York one is very creative. And the problem with it, as in all of these things, is, how do you measure the control group? What are the numbers, and how do you affect the benchmarks? And, but the point of both the social impact bond and the social innovation fund is buying outcomes and agreeing on the outcomes and knowing how the curve has been bent is a great way to induce innovation as well. The next one down. Level the playing field. I'm aware that in every one of these little items, you all are, many of you are more expert than I am, but we do erect at the state and local level a number of rules, some of which are legitimate if you want to go into the business of helping kids, and some of which are onerous, right? So what do you need an MSW to do? What sort of certification you need to be a drug counselor? What if you had an organization that could reduce drug abuse by 25%, but you weren't going to do it with a sufficient number of MSWs? When I was trying to active in the early childhood education world, right? I mean, even back in the old days in Indianapolis, trying to figure out where I could open a child care center, right? I had all these rules that, I had the right number of feet of grass, so it'd be better off if kids didn't have access to child care than if they had access to child care with X minus 25% of play space, right? So, so the only point of this is in any one of these fields, there are legitimate and there are overly onerous restrictions for participation on the supply side of these services, and we ought to scrub those out. As we go down through the bottom there, reward and protect risk, mobilize community awareness, empower citizens. So another problem in the worlds in which I operate is that, so when I started in New York City, it was right in the early days of iPads, right? And so Mike Bloomberg had an iPad, and I sat right next to him. We had an open bullpen, so I had to have an iPad, right? So, but I could just go buy an iPad, right? Because I have the resources to buy it, and it's an innovation I liked, and I wanted an iPad, so I bought myself an iPad. If you're poor or don't have much voice and you're in need of services, our definition of innovation is primarily a supply-side definition of innovation and not a demand-side of innovation, right? Because people who need help often don't have the resources to make decisions about where they get that help. And it's worth noting that that's one of the reasons that innovation doesn't move across the country very well, because it moves across the country when people buy it in positions of authority, and they're restricted by entrenched interests in how they exercise that authority. And folks who need help don't have a lot of resources. So as the bottom part of this says, what can we do to actually increase the responsiveness of social programs to folks who need those social services? Now, that could be vouchers for some things. It's very provocative in some areas like schools, but maybe less provocative in areas like workforce, but we ought to think about that. Another is how do we give voice to people who are using services? I've recently asked a group of officials how many of them capture tweets back from those who use the services, right? Do we ask them what they think of these services? I'm working with St. Paul now on a project that might ask those who are involved at after school to actually tweet back and mine the social data to find out what those young adults thought of what they received. Now, that may not take the place of professionally done empirical studies, but I think people who are served, we should capture what they think, and we should have that affect how we move forward. So, or maybe it's mobilized community awareness. I think of, in terms of social innovation, as Stand for Children as a particularly interesting innovation, because it mobilizes communities for more resources for education for children in need of services. That's one way of giving voice to those in need of these support systems. So I'm just suggesting that when we think about social innovation could be an innovation that changes the ecosystem by giving more voice or power or authority or other tools to those who are in need of help. That's one way to create innovation. Now, if we go up around the other side, and I know that you have again, those of you involved in your well-respected philanthropy school may or may not disagree, but I actually think that the nonprofits in many local communities are also the problem. And the reason for that is the following. When I was in Indianapolis, so the theory here is there's an iron triangle of funding in local communities around social services. So when I was in Indianapolis, there was a group of well-respected nonprofits, and they all had boards. And on the boards were local businessmen and women and others, right? But local businessmen and women of a good repute and success, right? And so if I went to change one of those programs, I would hear, it turns out that every board member asserted that they had contributed to my campaign. I don't think there was one board member who said they didn't, right? And the board members are also involved in the United Way allocation committees, and they're also involved in the political process. And it's not like they're bad folks, right? My organization we have very good intentions. We have good intentions, and you need to protect us. And back in those days, before the United Way got a little bit more active in terms of outcome funding, if you went to the United Way for a grant and your results were not what you had promised, then that earns you the right to come back the next year for more money, because the reason you didn't do well is because you asserted you didn't have more money. And it's not like it was a game. People actually thought it, right? Because they were well-intentioned people. So you find yourself inside these kind of iron triangles where it's very difficult to create a local culture. That's why if there's a community foundation or a local philanthropist who's willing to challenge the status quo in a very energetic and precise way, that they can make a big difference. Now, you may agree or disagree about it, but it's an interesting case study about what Bradley did with vouchers in Milwaukee, right? They funded the vouchers, they funded the study, they funded the schools. I mean, they were all over it. It wasn't, and it was definitely designed to create a disruptive influence in the way education was done in Milwaukee. And irrespective of whether you're for or against that solution, it is worth asking, how does one create a different culture for innovation? In Indianapolis and in New York City, if you said who are the large funders, well, they're not just the Gates of the world. They're state government, and they're city government, and they're United Way. They're big funders. The big local community foundations often have a role as well. So finding somebody who can kind of change that and move to these more outcome-based funding pots, to have innovation funds, venture capital. When I was doing my work in Indianapolis, in those communities, those neighborhoods I mentioned to you, all of my venture money came from Casey Foundation. All of it did. The city council wouldn't get, didn't have enough money, and they were going to give up the incremental money, and the state had their money all committed through traditionals. And if I wanted to prove a new model, then I had to use foundation capital to do it. And it's also good because it's easier to risk failure with non-public dollars. I had this brief conversation with the White House and the president about the Social Innovation Fund. I was in a curious position. I was a Republican in charge of the presidential initiative and of the other party, in part because these issues I think are nonpartisan issues. But I said, let me just get this right. The definition of innovation fund would mean if we're innovative, and like if we were in business and we hit 50% of our money led to success, we'd be pretty successful, right? If we had a venture fund and we were 50% right. So the way this works is you want me to go up to the House for one of these review committees, and I'm going to say, we spent $50 million and we only wasted $25 million of it, and therefore we were successful, right? To which the president said, yeah, that's the definition of innovation fund, right? So I mean, you can see a little bit the politics here of using public dollars to innovate is a little bit more, difficult. Let me make a couple last comments, and then just do this by way of a question and answer. I do think that some of the most exciting points of inflection are those where somebody creative takes existing assets in the system and moves them around in a way that makes them work better, right? So it's not just more money for a new program, because there's a lot of money and there's a lot of innovation out there. It's how can you make it work better? I mean, I thought, although the program has been around for a long time, I thought one of the interesting things about communities and schools, where they work, they generally work very well, is that by putting a little bit of money in the school through a social innovator community in schools and making the existing set of public health and children's services work better around that family through having somebody in the kid's life in the school, leverages the other services better. When we gave an award, Innovations Award at Harvard to a program called Wrap Around Milwaukee, it was because the fellow in Milwaukee had been able to figure out how he could create essentially a managed care system for children in need of service. He took the delinquency money and the CHINS money and the Medicaid money, and he said, just give me that money and I'll tell you how much I need per child, and I will guarantee that I'll make it work better, and then just remove a lot of those rules. So to have somebody kind of make the system work better with existing resources is particularly exciting. That's one, another Harvard winner. I keep coming back to Linda mostly because she's won a lot of awards and also sat next to me. But one of the interesting things about the initiative that Mike Bloomberg did in New York City with the fund called the CEO Fund was he took public and private capital and put it off into a venture fund and said, tell us how we can do X. Eliminate poverty, increase high school graduation, or the like. Give us your proposal. So somebody kind of disrupting the system is particularly helpful. Somebody creating a system where it didn't happen before is particularly helpful as well. As I kind of step back from this, in many ways I'm hopeful, in some ways I'm not. I see a lot of my students who are deeply excited and interested in the social innovation movement, right? They're everywhere. And I know from my work at the Corporation House Community Service that the commitment to public service and community service by young adults is greater than at any time in decades, if not back to the great generation of World War II. So we have these great repositories of assets, right? People who care. But we've got these serious social problems, income disparity and other issues facing the cities. And so I think what we'll see is lots of innovation. The problem is, how does that innovation create enough disruption that it forces a repurposing of the existing dollars, right? Because if the definition of social innovation is only limited to whether a new program with a new group of eager people can solve a problem for this group of kids or this family or these folks who are homeless, and it doesn't have any effect on the existing establishment, will never reach scale, right? I'm sure I'll step on somebody's toes by closing with the story, but you know, when we were doing this $75 million social innovation fund with the, I keep forgetting you're YouTubing me, and I get a little carried away in my, before I teach my classes, I tell my students, I know that you're going to record me, I ask you not to record me, and everything I say is for purposes of kind of, you know, pedagogic reasons, and it's not really stuff I really believe, so, you know, there's a lot of controversy about is Head Start good or Head Start bad or whatever. But you know, there were plenty of GAO reports that reflected that the bottom 15% of the Head Start contractors were really not very good, right? Their results were not very good. So let's assume that 80% of them are really good, and that only 20% are not so good based on GAO results. It's actually obviously much more of a curve than that. So. Okay, so we're putting up with $1 billion a year in bad results, or at least insufficient results from, some may be harmful actually, but let's assume that they're just merely worthless, from Head Start, from the worst Head Starts, right? This is not an indictment of Head Start, right? But just assume that the bottom 15% are not doing what they need to do, the bottom 20%. So we're putting out $50 to $75 million in the Social Innovation Fund at the same time that we're tolerating $1 billion of incomplete or insufficient services from dollars that we don't have anymore, right? There are not enough dollars to do this. So I'm excited about the Social Innovation Fund and the social innovation effort, and particularly what you're doing, because I think if we study what works and we're rigorous about these empirical results and we have a very good dialogue about outcomes, because just the definition of public value and outcomes is a very exciting and hopelessly complicated subject, but where the perfect doesn't have to be the enemy of the good. So let's say that you're involved as an academic institution with a center, right, and you're focusing conversation on innovation, you're focusing conversation on how to define public value, and focusing conversation on the mechanisms to get there, and then finally what the relationships are of the sectors. Then maybe, you know, with the tools we have now, the social media tools and the like, if we give voice to those who are underserved and we show the way to to how to resolve some of these problems, and we kind of harness that energy that comes from young adults and adults alike who care about service, I think we can make a difference. But so long as we hide behind these, well, they're good intentions, so let those organizations continue to try to do their best. We're not being fair to the neighborhoods that need the help, and not being fair to ourselves as professionals. So I appreciate what you're all about, and happy to answer your questions. Thanks very much. Yes, sir.
So this could be the wrong direction to start the question and answer time, but this notion of disruption, one could argue that the sequester that just happened is a way to innovate by forcing funds to be allocated differently. Right? It could be exactly a disruption movement within the federal government. And I just wondered your comments about how to separate out positive disruption from potentially harmful.
Yeah. Well, the problem with change generally, and disruptive change in particular, is the chances of getting both are quite high. Right. The problem with giving social service agencies and their individuals more discretion to configure services in a creative way is that there's more likelihood that they'll abuse their discretion. There's more likelihood they'll use their discretion, but there's, right? So, at one level, I'd like to say that the sequester will create the pressure for change that's necessary. You have to almost be reading no story about Washington to conclude that that's a reasonably likely outcome, right? So,
we're on the other coast.
Yeah. Well, I think that, it could create the conditions. The problem seems to me to be, I don't want to go too far down the wrong. I mean, you could take me down a political path I don't want to go down, but. I do a lot of work with cities, so I'd rather have an anonymous city than a federal government attacked on YouTube. But is that the legislative process? I'm from the executive branch, right? So I'm biased about this. But the legislative process, almost everywhere, it feels to me like, is designed to protect the status quo, right? The head of the Water and Wastewater Authority is there to make sure that the chairman of that subcommittee knows those folks and knows those systems, gets their information from them, and if they're professional, right, if they're not corrupt, but they're professional, says they're good professional people. But how do we know that they're the best? How do we know that their results are the best? And so the current legislative process doesn't lend itself to taking these lack of resources and turning them into new approaches. And it's partly driven by the fact that we also appropriate and authorize in verticals, and people live in these systems. And so the big changes I see that creative mayors and governors are doing are ones that are driven across these agencies. And so I would be hopeful if we had a base closure commission for X, right, whether it's the agencies or otherwise, and an opportunity to kind of change the way we do services. I don't see now how reducing spending, actually, or even increasing spending, in and of itself will have much of an effect. I'd like to be more, I promise I'd try to be more positive in all my answers. I've been in government for 30 years, you know, so. Yes, sir.
What's interesting listening to you describe it is that if I were in a business school, I could give the same lecture about private enterprise, about all of these issues. And so it strikes me that many of these issues are deeply about large bureaucracies of a certain sort.
Yes.
And so then you say, what happens that's different in some places where you have easier entry? You know, you don't usually have new governments arising this week or next, right? And we know that, first of all, there's bankruptcies, right? You know, we've watched a whole bunch of them of late. And we know there are innovative companies which displace others. And so it's a very deep problem here. And they displace them not in the sense that those other guys can keep going. They really get displaced. You know, a large amount of resources don't work that way. Right? And so it's a very good problem to ask here, how do you create, in some sense, it's exactly your problem. How do you create disruptive organizations? I don't have to use the word disruptive. Organizations which somehow are able to, how to say, displace the products produced by others.
Yes.
Which then people find attractive. So, for example, you might have, you know, all those MSWs or city planners or public policy people be displaced because suddenly you have a different way of administering, right? And you can imagine how the social work schools, the public policy schools would feel about this. But you could have that happen. So business schools have tried to go into the business of social innovation, you know, saying, you know, Yale, remember Yale's, the development of Yale's business school was based on that idea. So I think there's an interesting, I don't like using Google or any of those things as the model, but historically...
Need a question.
Oh, I guess I don't have a question.
Let me take it as a question. So I think look, we need a surrogate on the demand side that represents the or proxy that represents that compensates for the absence of a customer.
Right.
Right, because the customer in many of these innovations has been me. I mean, right, I'm a mayor, I want better changes. I'm going to demand those dollars be spent. I'm a head of a federal agency, I have dollars to spend. I'm going to assert my authority in a way that does it. I'm a Bill Gates and I want to solve X, and I'm just going to write a huge check and cause it to happen. And so we've got. So your observation, if not question, is really interesting because we have a number of things. We have organizations that don't easily go out of business, whether the government, even the bigger nonprofits, don't easily go out of business, right? And so that's one set of problems. And we have the absence of customers, so that innovation can't jump easily across geographical lines because the consumer is somebody more powerful than the person receiving the services. And so then you have to say, okay, well, how can we compensate for that? We can compensate for it with a lot better, more transparent, open information so people will be, you know, dissatisfied with the services. And to some extent, that's the goal of providing every mom and dad the information about how their kid's doing, but we see that that has only, so, you know, if you have more information but you still have no ability to make a choice, that's kind of a limited benefit as well. So I'm just saying, I think your observation is really important, and thinking about how to compensate for that observation may be the thing that is particularly important.
Actually, I would suggest, okay, I'd like to give Martin's comment a question. And that is, when I look at this, I see a little board game. You know, how do we go from this side to that side? And we get right to facilitating and encouraging efforts to improve collaboration. And then it starts, right? This is really the start of the social innovation, not the end, right? It's not that.
Correct,
yes. Iteration.
Yes.
This is where we somehow, and what strikes me, I'm going back to your time in Indianapolis, is that how do you do this without starting Google replacing Microsoft? How do you, you know, instead of Google replacing IP or the better nonprofit replacing the old nonprofit, somehow it's the same thing. I mean, government doesn't, we're not going to, you know, tomorrow we're not going to say, okay, this government's gone, let's have a new government. We're not going to,
right.
I mean, in some sense, it's somehow we have to do this within
right.
the same organizational structure. And when we have disruption, going back to Yuri's question, it is there. It's not disrupted in the sense of the disruption of the market, so that one company replaces another within that disruption. It's within the organization itself that has to happen. How do we manage that?
Right.
How do we manage it to allow the disruption that allows the innovation to get to the new stuff without it breaking down?
One of the interesting things about your disciplines and the breadth of your school here is that you touch the answer to this problem from different perspectives that are interesting. Let me respond for a couple minutes in the following way. So I think as you know, I moved from a privatization model to a competition model, because the privatization model assumed that the private sector was inherently better than the public sector, as contrasted to what I think turned out to be true. This is a long conversation based on an old book I wrote, but that the public system was in many ways inferior to the private system, not the public employees. All right, so we did this competition model and allowed our unions to compete, and they dramatically changed the way they did business. I mean, it was just, I'll talk to you about it if we have time at the end, but it was so exciting the way they changed. So then, because what happened is the competitive forces from the private sector, I don't want to keep using disrupt, it's so changed, so changed the public sector's approach that they had breakthrough transformations how they did work. So then I just imagined that would work on public education, right? Because the public education in Indianapolis was pretty bad in a couple of the systems. And so I became involved in the charter school movement. And I became the only, I think, Jewish chair in America of the Archdiocese fundraising effort for public schools, private for their schools, because they were the public school of choice in inner city Indianapolis, were the Archdiocese schools. So, but what happened is, and this should come as no surprise to any of you, and I don't know why it surprised me, is that the effect of those schools on the residual public schools was nil, because the public school system had not liberated its schools to compete, right? They still had centralized curriculum, and centralized bureaucracy, and centralized collective bargaining rules. It's not that the fact they were collective bargaining, it's that they were all the same. Everything was the same, right? So this may seem unrelated to your question, but to me it's, right? Because one has to both create the attention for change and the capacity for people to change. So my successor as mayor, a guy named Bart Peterson, really smart guy, opposite political party, very professional, picked up my public school mess, right? It's too strong. My public school weak results. And he did a couple things. One, he went to the legislature and he got charter school authority for the mayor, right? So he says, I'm going to charter schools, and I'm going to hold those schools accountable, and I'm going to show what they can be like. So we're going to elevate these charter schools. So instead of the chartering agency being the same as the agency involved, it went to the mayor's office. I think at the time it may still be the only mayor's office that has charter school authority. Second, we're going to do this very visibly and openly and transparently. We're going to measure the results, and if they're not operating well, we're going to put them out of business. Third, he said, then after a while, look, you know, we got more charter school capacity, we have more charter school authority than we have capacity to deliver. We don't have enough folks involved in how to create charter schools and how to manage them well, right? We're going to outstrip our, so he created from the private sector with philanthropy a nonprofit called Mind Trust that recruited the best and the brightest from around the country and brought in all the good social entrepreneurs to Indianapolis who had never been there before. And so he created the human resources necessary. So now, to look back at it then, there was an effort to change the system from multiple places in the system to accommodate what you mentioned. So I think, you know, I write in my book, I think that Brian Gallagher, the president of United Way, has done a really, United Way of America has done a really good job of trying to move the United Way from an organization that raises money to an organization that kind of works with communities to change their social infrastructure. So it could come from any place, but if the public sector can facilitate the social innovators making a change, it really is quite helpful.
I'd like to ask you a question about scale, because you've obviously had experience at different size governments, Indianapolis, DC, New York, all different sizes. We're here in LA, which is like the largest county, as you know, in the nation, and a very large city and an intractable school system that's bigger than the city. Believe it or not, it really spills over. But so often the problems are really ones of silos. The innovation you're requiring, what you're looking for is collaboration across sectors, across the silos. The bigger the government, the bigger the silo, the taller the building. HUD is 8 stories and massive. And here in LA, we have like 3 different housing departments in the city. It's a big city, lots of departments, lots of fiefdoms. So what do you recommend about dealing with the scale issue? I mean, I'm just, in the back of my mind, I keep thinking, you got this idea because you were in Indianapolis. You had more hope. You had a medium-sized city. It was more tractable. But how do we transfer those smaller city lessons to bigger scale, where there's more rigid barriers?
I agree with all that except the description of Indianapolis as a small city. So, all right. Thank you. Okay, I accept that. Well, it's obviously an issue. One place to begin the addressing your question, of course, is what do we mean by scale, first of all, right? Because when I was at the Corporation House Community Service, it felt first like the definition of scale was an organization that was bigger. So City Year was really successful, so City Year got bigger by going to bigger scale. And a lot of social innovators begin, you know, I'm going to prove my concept and go big. A, that has its own restrictions because it's not clear a lot of these things actually scale. And B, it may be an unfair definition of scale, right? So if we can scale an idea, we can scale a policy, we can scale an approach, you could even think of it scaling a franchise. There's plenty of ways to scale that are other than, I know that's not how you meant your question, but they're other than just bigger, because we tend to get into this kind of set that bigger is better, and a lot of these things are successful because they are at a small scale, not at a big scale. I think in pick my words because this guy behind you carefully. New York is a very interesting model for the following reasons. First, I think it's very professionalism. It's a very professional city government, really, as it's kind of, you know, it's the 100 years plus after Tammany Hall. It's very professional. Everything is very well documented. But its professionalism makes it, in many ways, much more difficult to innovate, right? Because the definition of professionalism is really smart people, well-trained in a vertical, and very professional, make decisions about what should happen in communities inside that silo, right? And so, you know, to some extent, professionalism becomes a curse of innovation. I've kind of oversaid it, but right. And so Indianapolis maybe had a little less of, fewer PhD, MDs, MPAs, you know, in each of those silos, but it was also easier for me to kind of elbow them into doing something different. So what I think is interesting about what Mike Bloomberg has done is he has, with Linda Gibbs, tried to create structures that would cause innovation. So the CEO fund was venture capital designed to give us your big ideas. The social impact bond was buying outcomes to do that. Now the problem, though, I think, is that those will have limitations unless the next mayor takes the lessons from those and embeds them in the contracting process. Because my experience in both New York and Indianapolis is that those RFPs to those nonprofits are so prescriptive that they basically don't give them a chance to innovate across those silos. So I think that scale is a problem because the bureaucracies inside the existing delivery systems are so strong and so connected and so moneyed and have so much authority, and because the alternative structures are relatively weak. And as you know, it's true in my work in Indianapolis that, you know, the beneficiaries of change are inchoate, right? They don't know who they are, and even if they knew who they were, they don't believe you, right? And the adversaries of change are really focused. They know who they are and they know what they have to lose, right? And so the role of the leader is to create energy for those who are the latent beneficiaries. And if you can't do that, you can't make the change. And whether it's LA Unified or otherwise, those bureaucracies are, I mean, you know, if you look at it, you know, the Head Start Association, I've got the name wrong, they're very strong in maintaining and protecting Head Start because they don't want to see it hurt, right? The public housing authorities, administrations, public housing authority, whatever that organization is, they're very strong in protecting public housing. And so there aren't many people who are quite as strong in protecting those who are the beneficiaries of those, and we have to change that. So I think scale is an issue, but maybe we think about scale differently. We think about how we put out money different, how we use authority differently, how we grow and nurture outcomes better, but maybe not scale in terms of the size of the organization.
I have a question that kind of has to do with government disruption and failure. I agree that it's really hard to get government to do anything differently for any number of reasons. But one of them is the fear of failure that you identified.
Fear of failure?
Fear of failure, right. The cost of failing is enormous.
Yes.
And the bigger the bureaucracy, it's almost the too big to fail thing, right? And it's very embarrassing for governments to fail and all of that stuff. But at the same time, if we're really interested in innovation, there's gonna be failures. That's part of the recipe package. And I think in addition to that, government is often in the hot seat here because of the customer problem that you described earlier. So, you know, the latent demanders are not the ones that are going to get this ball rolling. So the responsibility kind of often ends up in government, even though it's in many ways kind of the least structured to take on this entrepreneurial, risky kind of behavior. Do you have ideas about where we go with this? You know, is there a way, or are there little niches in this structure that allow us to provide that flexibility?
So my general view of the role of government is some people think it's too small, some people think it's too big. You know, I occupy kind of the middle of the table that says whatever, you guys can argue about the size of it, my job is to make it more effective, right? Whatever you spend, let's just spend it right. So in the social service area, the opportunity and the problem is that government is the takeout money for every new idea, right? I mean, there's very few innovative ideas that a foundation or philanthropy starts that after 3 years, I mean, either that after 3 years they're not successful and nobody funds them, or they are successful and nobody funds them, right? Because they have to be taken out by government. And therefore, government is the dominant, by far, position taker in social services. So part of your answer is, how are we going to think about government repurposing its dollars to invest in that which, I mean, I think a really good role for, on risk is for venture capital from philanthropy to pay for the high-stakes venture entry-level risk. But and then government to think about how it's going to be kind of, you know, play the next round, and it doesn't do that very well. That's one. A second, I'm not, you know, I've had my own problems with the press over the years, you know, some good, some bad. But I have a different complaint about the press than many. I think that their preoccupation, I'm talking about well, both the social media press and the regular press, with finding an event that they can complain about, causes government to operate at the level of mediocrity, right? Because every change is going to have a disaffected person who can find their way to the press, and they're easy stories. I mean, they're really easy stories to write. I ran for governor, and I thought, you know, in the press wanted to report about something bad I'd done. I did about 50 things wrong every day. I mean, honestly, right? I mean, it was not hard if you were a good reporter to find something to embarrass me about. I fed it to them, right? But and some of that stuff deserves to be reported, but if you report only that and you don't report the failures of the existing system, you don't report the disservice to folks without voice, right? You don't report the lack of outcomes for the dollars we're spending, then the system gets turned on its head because, like you say, right, risk avoidance, rational conduct is you avoid risk, and not just as an elected official, right? I mean, think, you know, we gave an award several years ago to a really talented head of child welfare in Massachusetts, and he did something that seemed really obvious. He sent 2 workers out to visit a home. 2 child welfare workers went out to visit a home, and he found out that the results of the 2 were much better than 1. And they were much better than 1, I'm going to put my own kind of spin on it, because they had 2 people to discuss it, and together they were willing to take risks that one of them alone wouldn't take. Not because they thought about it as the avoidance of risk, but because they had reinforcement for doing something different, right? So we spend a lot of resources in social service providing either too many resources to people who don't need it, or not taking chances where we need to take those chances, because they're all, I mean, if you think about it, leaving a kid in a family may be the right thing for the family and the kid. It's very, very unlikely that it's equally good for the child protective service worker who made the decision to leave the child in the family, right? Because the risk of something going wrong are really high. If you look across the country today, I don't know what the number is, but there is a huge number of child welfare directors at state agencies have lost their jobs because of, no matter how good they are, because of kind of one atrocity. And the atrocities are bad, they're horrible, they're traumatic, but they distort the system in terms of the results. So I think a little better reporting and a little better use of the government dollars as the second place in the kind of risk-taking model, I think, would be helpful. There's a much more sophisticated answer to your question, I'm sure. Are you calling on people so I don't make anybody mad? Why don't you do it? Okay.
I want to go back to your opening comment about no one sector has like a monopoly on innovation. And so what creates the moment for risk-taking? Is it the leader, the individual executive, or, I mean, what's the source of the innovation, the willingness to take the risk to disrupt the system, and, you know, if it doesn't work, it doesn't work?
Well, I don't know. I mean, it can come from anywhere or nowhere. I used my example of the juvenile court judge in Indianapolis because he had a lot of, right, if you think about this, a public official has contracting authority and real authority and rhetoric and money, right? So you don't have to, you can cause change in lots of different ways. You could imagine that a community foundation or individual philanthropist with enough money and a laser enough focus could change an area. And the interesting thing I looked at when I wrote this book was, could one create a culture of social innovation in a community? Now, I'm going to go back to whether Los Angeles might be too big, or maybe the Crenshaw neighborhood is the right size. I don't know what it is. But, you know, how do we say, we're going to get the community together and the United Way together and the individual funders together and government together. We're going to say, look, the social results in this community, city or whatever it is, they're just not working. They're just not satisfactory, right? And we can't survive as a community, and those folks in those neighborhoods can't survive. And then how do we create the conditions for change, right? And maybe the result of that conversation is that it's recognized that change has to occur, and that we're not attacking any one group, and that that process provides a little inoculation to the system. So, or it could come from, a social innovator, and we see some interesting things happening in different areas. But in the end, I think it has to be more of a community-engaged conversation led by better outcomes and better measurement.
So I'm really, I guess a couple of things that are going on, and you made a couple of statements in terms of using discretion in negative ways and hiding behind good intentions. And so as someone who's really seen much more kind of collaborative decision-making going on in communities, I'm wondering why there's this kind of disconnect between always assuming that the media has to carry the message and not the community carrying the message. And what would it take to kind of take the community message to another level in terms of the discourse? I mean, what's hindering that kind of voice?
It's a really interesting question, and a fairly complex one. So we have to organize the community conversation in a way that is visible and has a chance of succeeding, right? So how does one curate that conversation and connect that conversation to decision making? Both of those are worth thinking about. I'm relatively optimistic about the use of social media because, now that there are more smartphones than there are computers, and that folks in even poorly served communities have the ability to kind of respond in the social media, I think we could probably mine that data and organize it better. But then we have to be able to kind of use that information in some way. People have to be able to kind of express them. Somebody has to actually listen to that. And government will slowly get to the place where it has no choice but to do that. I've been thinking a little bit about this conversation this morning with the mayor of Minneapolis, who's a particularly creative fellow. And, what is it? TripAdvisor, right? Everything I say is like 2/3 right, so just TripAdvisor, right? So the hotel manager puts a picture of the lobby on his TripAdvisor, which looks beautiful. Then the guests take pictures of their rooms that look not so beautiful, right? And they post them up there as well. And then you go and make your trip and you see it. But the reason that people do that is because the manager of the hotel will look at TripAdvisor as well as his boss and figure out what's going on. So I need to figure out a mechanism that the comments and pictures and tweets and whatever about my community, my school, my social service program are actually consumed by the people who have authority to change them. When we get that connection done, I think we'll actually do better. Let me just say real quickly, I think a lot of my thinking, I think, we all come from our own context. I think my work on child support was in some ways the most important work I did, because every week I met with AFDC moms in small groups and asked them about their lives, right? None of the stereotypes applied, right? And their real life stories were very effective. And had I not met with them, I would have had no idea what I was doing. No matter how well trained I might be, I would have no idea what I was doing. And we live in a society where you can live your entire life without seeing anybody really poor. I mean, if you manage, if the homeless are not on the street and you take the right turn in the car, you don't actually have to see any problems ever, let alone understand what causes them.
If I could take you back to a couple of the things you said, by the way, I think it's fascinating. I appreciate all the perspectives. But you mentioned at one point the difference between the public and the private was the institution, not the people. And you also talked about professional, and professionalism may be the enemy of innovation, or could be. And yet, in my own experiences, I've met an awful lot of leaders of public entities who are actually very professional and very smart and actually see problems.
Yes.
The challenge, I think, is not that the professionalism is the problem, it's their constraints. So we were talking about an institutional redesign issue here, and I'm wondering if you could help us with some examples of where those and you mentioned in charter schools, I mean, welcome to LA, about, we have charter schools and we haven't got the public school system changed. But where there are some success stories that suggest that, in fact, you can be a public servant and be an innovator.
Right. Well, thanks for the correction. I mean, my career has been designed to provide motivation and tools to public sector innovators, right? So I'd like to agree with your proposition. It leaves me with kind of a hollow sense about my accomplishments. Yeah. I'm just standing so I can see you. So, and because your question was hostile, I thought if I had some height over you, it would be helpful. I think there are plenty of stories where, well, let me go back one second. So I totally agree with your correction of my use of the problem about professionalism, but that is the way I meant it, right? In other words, that it's not like these are bad folks who are poorly trained. It's that they're trained inside that silo, and they often don't have access to, even if they thought differently, it's very difficult to get access across these areas. And you know, it took me 10 years to negotiate a truce so that I could share information from the juvenile probation officer to the juvenile police officer to the school social worker to the child protective service worker, when each one of them agreed they'd make better decisions if they saw the information, but they weren't allowed to see it. And then often they'd also say, we'd make better decisions, but we don't trust the other guy to use our information. But anyhow, so it is this the narrowness of the lack of peripheral vision. I think that one of the reasons that we're at just a fascinating point in time now is that data mining tools and data analytics allow you to make these breakthrough insights without having to reorganize government, right? I mean, if I have one more conversation with an agency CIO in one of these governments who says, I have legacy systems and my information can't be shared with somebody else, or pay me, it costs me $10 million or $100 million to do it. It's just not true. You can mine that data any sort of way, and we can provide algorithms to improve the utilization of discretion. So the Child Protective Service worker still uses her discretion, but she has decision support systems in her handheld that come from looking at the family in a broad way. Andy Casey's tried to do this with his with his casebook system. So all I'm saying is I think that we can, by professional training, get people to think about systems instead of their narrowness, and provide them tools, and mostly in information, and make that information consumable in a way that the field worker can make a better decision. And it also leads to the following, right, which is that my work is in government by network, and so a network can be much more effective or much worse depending on whether it's fragmented or it's organized, right? And so in New York City, many of those case management services are contracted out to nonprofits. I'm working with one as a volunteer now called the Children's Aid Society. It's one of the biggest and one of the best. They have very limited visibility into city information and almost no visibility into state information, yet they're dealing with kids that are placed in their care by the city and the state. And so, you know, we're reinforcing the narrowness, but also provides the opportunity to break through, and I think we can do it in pretty creative ways.
Going back to your beginning of your talk about the nature of public value. And if I understood what you said, it sounded like the key to public value is looking at outcomes, actual conditions under which people live versus outputs, you know, whether you build more houses or you provide more services. It's more of whether that actually changes the lives of people. And is that what you mean by social innovation, that shift? And secondly, how does that fit with, you know, the one that's often given, and it'd be nice if we could find 10 other ones because I'm getting tired of Teach for America, but I don't know if Teach for America actually does that. Maybe not. You know, I don't know if it's actually measuring whether it's changing kids' lives. So I'm not sure how, even if that is the definition you mean, how it actually is applied in the social innovation movement. And then, so that's one question. And then the second one has to do with, again, this notion of creating social value. And I want to refer to a professor who used to be at Harvard many years ago, James Q. Wilson, who wrote about the problem that a lot of the constraints that public officials operate have to do with different public values being imposed on that decision-making process. More public values than are usually imposed on a private decision-making process, such that you might be involved in public housing, but you also have to worry about diversity, and you have to worry about the environment, and you may end up with 5 public values that you have to implement. In fact, he referred to this as piling on of public values, that different constituencies in the public decision-making process impose on those agencies. So that, in a sense, is not bad. It's just that the outcome of requiring all those different things leads to rules and bureaucratic processes, and that organization trying to incorporate those values into its decision-making. So if you're going to get rid of that system, you're going to trample on public values, some of them, because you're not going to be able to touch all those bases in that decision-making process if you're just going to go to one. And so you may achieve better outcomes in that one public value, but you may achieve less, that's what, less good outcomes in the other. I mean, that's why we have due process when we hire people here, because we want, we want to get very good faculty, but we also want to get diverse faculty and so on. So if you just got rid of those rules.
So this is your definition of a non-hostile question, right? yours is much worse than his.
You're my hostile.
So let me.
It's a friendly place.
What? Yeah. I'm sorry, it was. So these are immensely complicated set of questions you asked. So and because we don't have much time, I'll answer them simplistically. First, when I was chairman of the Anacostia Redevelopment Commission in Washington, D.C., and I was a landowner in Anacostia for the new Washington Nationals baseball stadium, right? And so we had a number of things we were trying to accomplish, and the city council said, we want you to have WB MBEs, we want you to have local sourcing, we want you to have affordable housing of like mixed use of like 60%. We have environmental, so there were like 10 of these, right? The result was the property had negative value. We would have had to pay somebody, right? I mean, honestly, it was just because, and they were all legitimate values. I mean, there wasn't like any one of them was ridiculous. It was just like the combination of them was impractical. So the piling on concept is fair. I would suggest that an explicit discussion around the issue you raised would be a way to begin this public value. I mean, there's no definition of public value that's going to be correct or permanent or even right in any instance. There's shades of it. It's dynamic. It's going to change. And so for one to say, here are the ancillary values that we consider important that you have to factor in, and establishing which of those can be affordable or accomplished or practical, I think is a really healthy conversation. So, but I don't think those actually, I don't think very few public or private organizations actually think like that, right? They have this kind of group out there and they don't think about the trade-offs and they don't organize those. So I would acknowledge, even when I was trying to do it in Indianapolis and in New York, that it's never clear what the public value is, how to define it. And then if you go to the metrics for measuring what the public value is, they're never quite right, but the process is always better than it was before. Similarly, on your first question, I think what we're trying to do is understand the benchmarks of the current system and then measure how we're going to improve over those benchmarks. And sometimes outputs are all we can do. So, I kept giving this lecture about outcomes, and the president did the Social Innovation Fund. I was responsible for helping the Social Innovation Fund. It took me back to a period of time when I was at the Corporation Community Service, we took President Bush to a Stand for Children event, and we organized these things like you do for your presidents, right? So he went to a session with an AmeriCorps worker. The AmeriCorps worker, took the president and two young adults and taught them how to read, or some reading session. The president came back, President Bush came back, and he said, that was a really good program, but do you care that the AmeriCorps worker really did not know how to read very well, right? So, you know, well, oops, we forgot that piece, right? You know, so then President Obama starts talking about kind of output measurements, and they had really smart people in OMB, and the OMB was going to hold the Corporation Ask Community Service responsible. So I said, well, we issue grants for Teach for America and others who work in the schools, and how can we make high school graduation be the outcome when we're making grants for third graders, right? We're going to wait, you know, X years. So that didn't work very well, but then somebody suggested that, look, we know that reading at grade level at the end of grade 3 is a pretty good predictor of high school graduation. So why don't we just say we're going to give grants for the degree to which you can improve reading at grade for third graders who, you know, with and without. It's a long way of saying your question is enormously complicated. I would just suggest that we not make the perfect the enemy of the good. Are we out of time yet? Huh? Almost, right?
I think we have time for maybe one more question. Okay. A friendly one, hopefully.
Yeah, I have another friendly question.
Yes, sir.
And it goes back to
My friendly question.
yeah, back to his. I think in some cases professionalism is a significant part of the problem. It's not because they're not smart people and innovative in their thinking, it's because they're siloed, as they suggest. And I would offer as an example the collaborative learning project. We worked with neighborhood councils, did research on the 95 neighborhood councils that they emerged here in the city of LA, official neighborhood councils. And one of the projects we did was called the Collaborative Learning Project because we could see that these neighborhood councils didn't know how to work with city bureaucracies. Yes. So we brought them together and went through a kind of collaborative learning process. And the first one of those was with the Department of Public Works, which I thought was, you know, we're likely to fail right at the outset because of this huge technical bureaucracy. Well, as it turned out, the general manager of the Bureau of Street Services, with whom we worked for the most part, was a guy who was willing to, Bill Robertson, willing to take risks. And so he began, he responded to the neighborhood councils that were saying, we don't all need the trees trimmed at the same time. We don't all have as many, the same number of trees. Some of us need potholes filled, some of us need trees trimmed, some of us need sidewalk repair. You need to treat us differently. Right. So he created service plans for neighborhood councils and groups of neighborhood councils all over the city. So there was a social innovation that occurred in that process because of the disruption, to use your language, of the neighborhood councils. Yep. Connecting that expertise that was siloed with some intelligence from outside. Now, where it failed ultimately was in the inability to move across silos because the neighborhood councils really didn't have the capacity to deal with those differentiated service plans, and the Department of Neighborhood Empowerment was unwilling to devote resources to do that capacity building process. So, was that a friendly question?
Well, I think it's a good question to close on because I think it's hopeful in the sense that there is a lot of power in the crowdsourcing of citizens, and it requires, though, on the government side, a chief elected official who will force organizational changes in their bureaucracy. And but for that, the bureaucracies will act the same way that they've always done. And when I left New York City, you know, New York had a really good transparency movement and had, you know, community boards like these. But the agency directors often viewed the citizen complaints as, you know, unfortunate noise, not because the commissioners were bad folks, just because they often come across as noise. I hired on a grant an intern or a young employee, and we organized the 311 call data and took the data sets out to the community boards and showed them how to manipulate the data sets so that they could figure out what type of call, when the call came, when was it resolved, what would happen in a particular intersection. And the commissioners were fearful that it would just increase the complaint level, right? But it's not like those folks didn't know how to complain on their own. What it did, though, is it let them see what was going on, and they actually came up with solutions because, you know, the solution to a water problem may be a street problem. The solution to a trash problem may be a, you know, X problem. And so I think your example is a really hopeful one, so long as you can align that innovation with a government innovator who come together, and
That was another problem.
that would be the solution. Thank you very much.